So one of the requests of my patient was to get rid of the anger that she can see in the upper part of her face. When I was assessing her, I realized two things. When she is doing the angry face, can you do the angry face? Look what is happening. She's having wrinkles between the brows, but observe this part of her forehead. Can you do again relax? And again anger. She is moving down the hairline and she's pulling up this medial part of the forehead. What it means, although the anger is mostly recognized as a pattern in glabella, in her case, she is also involving the forehead. For me, the information is, if I want to get a very good balance of the muscles in the upper face, it's not only glabella that I need to inject, but also the forehead, although relax completely, do the surprise. When she's doing the surprise, you cannot see a lot of wrinkling. So, if I am seeing when she's doing the anger, again angry face, she is moving up this part of the forehead, I know that blocking just the glabella, she is gonna emphasize the movement of her forehead, and in few months she's gonna be back having wrinkling in the forehead. Relax. Also, what I realize is when she's doing anger, she's slightly moving the lateral part of the brow. But if I ask her, can you close your eyes tightly? More, look what is happening. She's not only moving glabella downwards, but she's performing crow's feet in the lateral part. Relax. Why I'm saying it to you? Because for me, botulinum toxin treatment in the upper face, in the mid face, and in the lower face is not really because of wrinkling. It's bringing back the balance of the muscles to maintain youth. Again, I'm talking about longevity, I'm talking about lifespan of the face, that we are not getting back from aging to youth, but we are keeping youth although we are chronologically aging. Now, when it comes to say where are points of my injection, I am not asking my patient to move so I can find where to put the point. I am analyzing the face according to anatomy that I know, and I am injecting muscles, not wrinkles. Why? Because as I told you, my philosophy is to bring back the balance. She's a young person with a very good volume, so I'm not mentioning now about the volume difference right and left. But when it comes to the movement of the muscle, it's also very important to see if both sides of the face are having exactly the same volume, because this is influencing what kind of wrinkling you are seeing in the upper part of the face. So before I show you where I put dots for toxin, I'm going to draw few things that will help me explain you where, according to my understanding of anatomy, I should place the toxin. So I am marking a line that is connecting inner corners of the eye. This is a place where I should meet the origin of the procerus. Now I am marking a bone of the orbital rim on the right and on the left side, because I know that somewhere here, when I see the roundness, is the bone origin of corrugator and depressor, and I want to get there with my toxin points. Also, I am having in mind where is the end of brow position. Of course, we are talking about brows that are normal brows, not the artificial one, because this is showing me also where is the orbicularis oculi muscle, which is integrated in the movement of the glabella. When it comes to the lateral part, I need to mark a Frankfurt plane that goes from the orbital rim, the lower part. Now I am checking where is the tragus. I am connecting these 2 points, and this line is showing me where I start having movement from the zygomaticus major and zygomaticus minor muscles, that if I am injecting toxin too low, I can interfere with the movement and patient is not experiencing nicely looking face. Can you please smile widely with your teeth? You can see the bulging below this line. So everything what I am injecting with the toxin has to be above this line. Relax. The second helpful line for me is the line where is the corner of the eye. And I can continue drawing the bone margin. So I know exactly where is orbicularis oculi, so I know exactly where I should place the points. I'm doing exactly the same on the other side, because our face is never symmetrical, so I cannot replace it just by thinking that something is there. I have to follow anatomy of the right side of the face and left side of the face. Exactly the same lines. Now, when it comes to the forehead, I need to palpate where is the crest. It's here. Again, palpating where is the crest. It's here. This is giving me an understanding where from I'm having frontalis, because it should be from crest to crest. Then I am observing where is the bone rim of the orbit, because around 2 centimeters above I should not inject toxin in order not to experience brow ptosis. And I am also asking my patient to do the movement of surprise, full surprise. I am observing if a patient first has a convergence line, which means if she can move upper portion of frontalis downward and lower portion of frontalis upwards, and she's doing it, relax. Now pay attention to this part of the frontalis. Maybe I will already draw it, because our patient is having convergence line, and you can see that the movement is going up to this line and low to this line. So when I'm gonna prepare the treatment planning and where I'm gonna put toxin, is really having a lot with this line. I cannot go only above, because this part will be too much movable. I cannot go only below, because then she's gonna experience too much movement above this line. I have to be somewhere below and above. Pay attention again. Can you do the surprise? More. You can see the length, the height of the forehead is getting smaller. This is why I'm telling that she's having a convergence line. Relax. Having now all these lines and structures, I am marking points of injections. So if I lift the skin, you can very easily see where is the origin of procerus, and here is exactly when I'm gonna inject the origin of procerus. Knowing where is the orbit rim, where is this roundness, this upper mid border, I know that if I inject toxin here, I am exactly at the origin of corrugator and depressor. And to hit them in their skinny attachment, but also to have influence in orbicularis oculi muscle, I know that I need to move a little bit up. Now look what is happening between those points when I ask my patient to do the angry face. Can you do the anger? You see all the points started to move. Relax. For me, this is exactly what matters the most. When I move the muscles, points of injections are moving accordingly. One more thing I forgot to draw is where is the supraorbital notch. It's here. Why it is important to palpate it? because you're gonna see the direction of the needle that I am injecting toxin being outside of this notch. When we are talking about possible complications from botulinum toxins, I would say they are not complications, they are just not wanted outcome if we don't understand anatomy. The possible reason why we have eyelid ptosis is that we are injecting near the notch, supraorbital one, or inside there. So knowing where it is, and it's easy, you just palpate it. I have to inject more medially or more laterally the toxin. Now when it comes to crow's feet, here is the bone rim, here is the first point when I am injecting between these two lines, then I'm going above between these two lines, and then I'm going even above. And look, I am meeting here the point where is frontalis. So if I don't want to see all the small wrinkles above the brow, I need to hit the portion of orbicularis oculi here. So frontalis is not anymore having possibility to work very strongly, because the balance of the muscle is releasing the tension of the frontalis. So exactly the same, I'm going on the other side. 1 point, second point, oh sorry, it should be above, the bone is a little bit wrongly marked. So 1, 2, 3, that's it. If you want a little bit more opening of the eye, if eye is not really very nicely open, you can add additional point just at the corner of the eye. That's it. Now when it comes to forehead, 1 point is exactly in the middle, a little bit below this line. Another point is at this line, at the level where I see Mephisto possibility. So can you surprise yourself? This is the highest projection. Go to me with your face. This is the highest projection. And then between those two dots, I'm adding another dot that is fully above the line of convergence. So I am creating relaxation of this line without influencing the brow position. So let me move to the moment when I start injecting.